walk to your bathroom mirror right now, tilt your chin down toward your chest just slightly, and watch what happens to the line of your jaw. The clean edge softens, a shadow forms. That shadow is what you are trying to erase every day. And yes, there are 6 exercises that a dermatologist can honestly defend for that shadow, but they are almost never the 6 you have been shown. One of them, done wrong, is deepening the wrinkles beside your mouth right now. Face yoga does not tone skin, skin does not tone. What it does is something stranger. Lift your chin back up. Look at yourself straight on. If you click this video, you already know the exact millimeter of your face that bothers you. It is that soft transition where the jaw stops being a line and starts being a suggestion. Maybe it is a small pouch of skin just in front of the earlobe. Maybe it is a vertical band down the front of the neck that appears when you talk. Maybe it is the pull of gravity under the chin that you never noticed until one photograph from a bad angle made you notice everything. You are not imagining it, and you are not vain for wanting to understand it. What I need you to understand first is why the common answer to that shadow is almost entirely wrong. The common answer, the one you have absorbed from 1,000 short videos, goes like this. Your face has muscles. Muscles can be exercised. Exercise builds tone. Tone lifts skin. Therefore, if you contort your face for 10 minutes a day, you will lift what has fallen. It sounds obvious. It sounds like the same principle that works for the rest of your body. And there is one study people cite over and over to prove it. A trial from Northwestern published in JAMA Dermatology in 2018, in which 27 middle-aged women followed a supervised facial exercise program for 30 weeks. The researchers reported a modest improvement in perceived cheek fullness. Modest. In cheeks. That trial has been rewritten by the internet into proof that face yoga lifts jowls and tightens necks. It did not measure that. It did not test individual exercises. It did not follow anyone with significant laxity. It looked at the upper and lower cheek in a small group of women in their 40s and 50s and found that trained observers rated their cheeks as slightly fuller after months of daily practice. That is the entire evidence base you have been sold as proof. Now, let me show you the anatomy that actually matters, because once you see it, you will never look at a face yoga video the same way. Think of your face as a canvas stretched over a shifting scaffolding. The canvas is your skin. The scaffolding underneath is bone, fat, ligaments, and muscle. When your jawline blurs, when a jowl appears, when the front of your neck starts to hang, the canvas is not what failed first. The scaffolding shifted. Specifically, this is what happens. The bone of your lower jaw quietly loses mass with age, especially at the chin and the angle, changing the shape of the frame your face is built on. The pads of fat that used to sit high in the cheek slide downward with time and settle at the jawline, creating the jowl. A ligament called the mandibular ligament, which used to anchor the tissue firmly to the bone along the jaw, stretches and slackens like an old rubber band. The deeper layer of connective tissue that holds everything up, called the S-mass, descends, and your skin itself, which used to snap back like new elastic, gradually loses the collagen and elastin fibers that gave it that rebound. Look at what is not on that list. Weakness of a facial muscle, because for the jowl itself, muscle weakness is not the primary problem. Contracting a muscle harder does not put the fat pad back where it used to be. It does not rebuild bone at the chin. It does not shorten a stretched ligament. This is the reason most face yoga fails on anatomy alone. Before you even talk about evidence, it is solving the wrong problem. But then There is the neck, and the neck is different. There is one muscle in the human body that does behave more like what you were promised, and it happens to sit exactly under your turkey neck. It is called the platysma. It is a broad, thin sheet of muscle that runs from your collarbone up over the front of the neck and inserts directly into the skin of the lower face. Read that again. It inserts into the skin. Almost no other facial muscle does that with the same broad, direct attachment on the neck, which means when the platysma loses tension, the skin it holds loses tension. When it develops vertical bands, you see vertical bands. When it is trained with the right load, you can actually change what shows on the surface. That single anatomical fact is the entire reason a small defensible group of neck and jaw exercises exists at all. It is also the reason the Northwestern study, whatever else it did or did not show, was probably not measuring what its authors thought it was measuring. It is why the exercises that actually help you have almost nothing in common with cheek puffs, fish faces, and exaggerated smiles. So here's the question you have to hold with me for the next few minutes. If most face yoga fails because it targets muscles that cannot fix a bone, fat, and ligament problem, which 6 movements survive that scrutiny? Which 2 mechanisms are actually doing the work? And why is one of the most popular jowl exercises on the internet deepening the very lines it claims to erase? The answer starts with something disappointing and then becomes something useful. Only 2 mechanisms in your face and neck actually respond to face yoga in a way a dermatologist can defend. The first is loading the platysma directly, the muscle we just talked about, the one that inserts into your skin. The second is postural. Almost none of us hold our head where it evolved to sit. When you spend 8 hours a day looking down at a screen, the deep muscles at the front of your neck weaken, the head drifts forward, the tissue in front of the throat compresses, and the jawline appears to soften, even when your actual face has barely changed. Fix the posture, and the jawline sharpens without anyone touching your skin. That is not toning. That is repositioning. Those are the only 2 levers. Everything else you have seen in a 10-second clip is either targeting the wrong tissue or asking a muscle to fight a battle it cannot win. So here are the 6 exercises that sit on top of those 2 mechanisms. Done in the order I would actually explain them in a clinic. The first is the chin tuck against resistance. Sit tall, place 2 fingers on your chin, and gently push your chin straight backward as if making a small double chin on purpose. You are not tilting the head down. You are sliding it back over your shoulders. Hold, release, repeat. It is not glamorous, but it is the closest thing to a lift you have. It reawakens the deep cervical flexors, opens the angle between chin and throat, and pulls the whole lower face back into the position it was designed to sit in. The second is a platysma isometric. Sit up straight and shape your mouth into a firm oval, as if you were about to whisper a long O. Press your tongue flat against the roof of your mouth. Then, without moving your jaw, pull the corners of your mouth down and slightly out until you feel the vertical bands of the front of your neck engage like guitar strings. That tension you feel is the platysma. Hold it for 10 seconds. This is the exercise you will not see going viral because it looks strange and it does not photograph well, but it is doing more real work than any smile-based routine. The third is a tongue to palate hold. Press the flat of your tongue firmly against the roof of your mouth. Seal your lips and breathe through your nose. You should feel a subtle lift along the floor of the mouth. The evidence for tongue posture as an anti-aging tool in adults is honestly limited. What is more defensible is the resting posture piece. If your tongue lives on the floor of your mouth all day, the soft tissue under your chin has no upward support. Retraining it where it belongs is a small mechanical change with a plausible mechanism, and it costs nothing. The fourth is deep cervical flexor activation. Lie flat on your back, tuck your chin gently toward the roof of your mouth, and lift your head just an inch off the floor. Hold, lower, repeat, slowly without letting your jaw jut forward. This is not a neck crunch. It is a targeted rebuild of the muscles that anchor your head above your shoulders instead of in front of them. The fifth is a platysma stretch with a release of the sternocleidomastoid, the thick rope of muscle from behind your ear to your collarbone. Tilt your head back gently, keep your lips closed, and slowly draw the corners of your mouth down until you feel a long stretch across the front of the neck. This does not build the platysma. It lengthens it and reduces the chronic banding that makes the neck look ropey. The sixth is the resisted jaw open. Make a soft fist under your chin, then slowly try to open your mouth against the resistance of your own hand. You will feel the muscles under the chin engage. These are the suprahyoid muscles, and while they do not lift skin directly, they support the shelf that keeps the space under your chin from becoming a permanent pocket. 6 exercises, 2 mechanisms. Now watch what happens when we go back to the Northwestern trial with these mechanisms in mind. Those women exercised for months under supervision. The improvement was in cheek fullness. That is exactly what you would expect if what actually shifted was not skin quality, but the resting position of the muscles under it. The face they measured did not become newer. It became more organized, and that reframe is the honest reading of the only real study you have been sold. Now for the exercise that is actively working against you. If you have ever puffed your cheeks full of air and held them, made an exaggerated fish face, or repeatedly forced a wide, artificial smile in the belief that you were lifting your jowls, I want you to stop today. Those movements do not train the platysma. They repeatedly contract the muscles that pull directly against the skin around your mouth, the same muscles whose overuse is one reason expression lines deepen in the first place. Every repetition is another fold across skin that is already losing the ability to bounce back. You are not lifting a jowl. You are etching a nasolabial fold. And here is the harder truth waiting underneath all of this. Even the right 6 exercises cannot fix what is not muscular. If your problem is mostly bone loss or heavy submental fat or skin that has already lost most of its elastic memory, no isometric hold on earth is going to reverse it, which raises a question you can answer tonight at your own mirror in about 2 seconds. Because the difference between the person these exercises can help and the person they will disappoint is not age. It is not effort. It is something you can measure right now with your own fingers. Do this now. Pinch a small fold of skin on the edge of your jaw between your thumb and index finger. Lift it away from the tissue underneath. Hold for a second, then let go and count. 1, 2. If the skin flattens back before you finish saying 2, your skin still has functional elastic recoil. If it lingers, folded and slow, for 3 or 4 seconds before it settles, your primary problem is not your muscles. It is the canvas itself. And that single test decides whether the 6 exercises we just walked through are going to reward the next 12 weeks of your life or quietly disappoint you. This is the piece that no viral video will tell you because it kills the sale. Face exercise works on scaffolding, not canvas. If your scaffolding is still holding a canvas that snaps back, retraining the platysma and the deep cervical flexors can visibly sharpen your jawline, reduce the vertical bands on your neck, and open the angle between your chin and throat. If your canvas has lost most of its rebound, no muscle underneath it can pull it taut. Skin does not shorten on command. Only new collagen shortens it, and only certain interventions can trigger new collagen at a meaningful scale. So here's the protocol I would give you in person if you pass that pinch test. Choose 4 of the 6 exercises, not all 6 every day. Start with the chin tuck, the platysma isometric, deep cervical flexor activation, and either the tongue to palate hold or the sternocleidomastoid stretch, depending on whether your issue is more resting posture or more banding. 10-second holds, 10 repetitions, morning and night. Do it for 12 weeks minimum before you decide it is not working. Real neuromuscular adaptation here takes that long to become visible, and the honest number for meaningful change is closer to 16 or 20 weeks. Anyone promising results in 2 weeks is selling you something. And here is what results actually look like, so you know what to watch for: a slightly sharper edge along the jaw when you look at yourself in profile, a neck that no longer shows 2 thick vertical bands when you swallow or speak forcefully, a resting posture where your head sits over your shoulders instead of drifting forward into your screen, a cervicomental angle, the angle between the underside of your chin and the front of your neck, that has opened by a few degrees. These are not surgical changes. They are real changes, but they are subtle. If your expectation is the jawline of a 25-year-old, no exercise is going to give it to you. That distinction matters because there is a whole other category of intervention that begins where exercise stops. If your pinch test was slow, if your jowl is largely fat rather than muscle position, or if the front of your neck hangs regardless of what your platysma does, the tools that can actually help are not in your mirror. They are in a dermatologist's office. Radiofrequency and focused ultrasound devices deliver energy into the deeper layers of the skin to trigger new collagen, which is the only known way to modestly retighten skin without cutting. Injectable deoxycholic acid can dissolve a small pocket of submental fat under the chin. Hyaluronic acid filler along the jawline can restore the bone-like support that your actual bone has lost. For advanced platysma banding, a procedure called platysmoplasty surgically tightens the muscle and the skin together. For advanced jowls, the honest answer is often a facelift, whether you want to hear it or not. I am not telling you this to push you toward a procedure. I am telling you so you understand exactly what exercise can and cannot do, and so you do not spend 2 years of daily reps blaming yourself for a result that was never mechanically possible. Muscle work handles a muscle problem. Energy devices handle an early skin quality problem. Filler handles a support problem. Surgery handles advanced tissue descent. They are not competitors. They are different tools for different tissues. And knowing which one your face actually needs is worth more than any single routine. Now walk back to the mirror one more time, tilt your chin down, look at that shadow again. Only this time, look at it differently. That shadow is not weak skin. It is not a punishment for aging. It is a small piece of information about your scaffolding, telling you which parts of the frame have shifted, which parts of the canvas have loosened, and which of them you can still move with your own hands and your own time. Some of it is trainable, some of it is not. And the value of the last few minutes is that you now know which is which. The 6 exercises are real. The mechanisms are real. The Northwestern study was real. but it did not measure what the internet said it measured. And the honest reading of it is a reframe rather than a proof. Face yoga is not skin toning. It is repositioning and platysma tension. Anyone who tells you differently is either simplifying to sell you a program or does not understand the anatomy under their own jaw. And the exercises that were quietly deepening the creases beside your mouth every time you perform them do not belong in the routine of anyone who has read this far. If any of what you saw in that mirror concerns you medically rather than cosmetically, if a lump appeared under your chin that was not there before, if the skin along your jaw is changing color rather than shape, please book a real appointment with a board certified dermatologist rather than trusting a routine to answer it. So here is your question tonight. Pinch that fold along your jaw, count the seconds until it flattens, and then ask yourself honestly which side of that line are you on? And are you training the right muscle or quietly etching a wrinkle you cannot take back?